Now that we understand how leads record the flow of electricity, let's review how electricity flows through the heart. As mentioned before, the flow of electricity can be thought of as the flow of depolarization. So understanding how the wave of depolarization flows through the heart is essential to understanding how it is recorded on an ECG. The impulse to depolarize the heart originates in the sinoatrial node, located in the wall of the right atrium. This impulse depolarizes the atria, resulting in their contraction as well as the P wave on the ECG line. At the same time, the impulse travels down the internodal fibers to the AV node, where conduction is slowed. This allows the atria to contract fully and is indicated by the PR interval. The impulse then travels down the left and right bundle branches of the bundle of His, before flowing through the Purkinje fibers and then from the fibers into the ventricular myocardium. The depolarization of the ventricular myocardium is indicated by the QRS complex, while the repolarization of the ventricles is indicated by the T wave. The QRS complex is the most prominent deflection on an ECG line, and this is what we look at when working out the net deflection value. What this diagram shows well is that the Purkinje fibers are located in the subendocardium. This means that the electrical impulse from the fibers depolarizes the myocardium from the inside of the heart outwards. On top of this, the left ventricle constitutes a large proportion of the total muscle mass of the heart, so a large proportion of the electricity flows through this left ventricle muscle. The net effect is that the flow of depolarization, on average, flows in the direction of the left ventricle. This average direction of flow is known as the mean electrical axis. Changes in the mass of the ventricles due to muscle or chamber enlargement influence the mean electrical axis. For example, right ventricular hypertrophy will result in more electrical activity in the right heart muscle and therefore cause the mean electrical axis to deviate closer to the right-hand side of the heart. Whereas left ventricular hypertrophy will result in more electrical activity on the left-hand side of the heart, and therefore cause deviation more to the left. Let's see how the normal MEA would look when plotted on the hex-axial lead system. We can see that the MEA is almost completely parallel to lead 2, and almost perfectly perpendicular to lead AVL. This means that lead 2 records a strong positive deflection. Lead AVF also records a strong positive deflection, although less strong than lead 2, as the average flow of electricity is not so closely parallel to lead AVF. Lead AVL, on the other hand, shows a fairly isoelectric deflection. The net deflection is slightly negative as the MEA is not perfectly perpendicular to it. Lead 1 and lead 2 record slightly positive biphasic deflections, and lead AVR a moderately negative deflection. Bear in mind that the MEA has a range of normal values in healthy animals. In dogs, the MEA should lie between plus 40 degrees and plus 100 degrees, with the left and right axial deviations shown in the diagram. In cats, the MEA should lie between 0 degrees and plus 160 degrees, with the left and right axial deviations again shown in the diagram. The variation is greater in cats, most probably due to the absence of a strong mediastinum that in dogs prevents positional change.